involved until I know what the deal is.
Okay, no problem, I totally understand. So basically, my role is like an admission nurse. So basically, I come and assess the patients and see how Journey Care can help you moving forward with your care. And then, see what options are available and what we can possibly do. So it seems like there was some, according to your medical records, what I have read, and correct me if I'm wrong, you have a stage 4 pancreatic cancer that was diagnosed 4 months ago. Have you done any treatments or?
Yeah, we had I had chemo.
Okay.
I did chemo, and it just it's had I've had a lot of adverse reactions.
Okay. Was your body not able to tolerate it?
I was just throwing up all the time.
Okay.
Nausea, vomiting. The pain was just too much. Waking me up at night.
Okay.
I've just been in the hospital the past week.
And what was that for, nausea and vomiting?
It was for nausea and vomiting. I couldn't keep anything down. I couldn't
Okay.
sleep. I couldn't eat. It was just terrible.
Okay. I'm sorry to hear that. How's your appetite lately?
It's not good. I mean, if I try to eat something, I basically throw it back up.
Okay.
So, the chemo's been tough, and I mean, it doesn't seem to really be doing anything.
Okay. And what are your, goals or thoughts about, what are your goals as of right now, since the chemo is not effective?
Well, that's like the point of contention in my family right now. It's like I want to. My wife talked about something like this, where some kind of comfort care.
Mm-hmm. Correct.
Versus, my mom is here. She just came into town and she's heard about this clinical trial. So
Okay.
I don't know. She says it can work miracles. So.
Okay.
Are
Are you trying something like traditional ways or anything like? I know like some cultures have their certain ways of doing things. Are you trying any other therapies other than like medical stuff or
just the chemo?
Just the chemo. Okay.
Church, and we're all praying.
Okay.
But the chemo isn't working. I just can't continue to go through that. So I don't.
Right.
I mean, I can't stand the suffering. So I don't know what to do.
Right, and miracles do happen. Everything's up to God.
That's what my mom
We're just
said,
here as humans trying to help you to go through this situation. So you're not there by yourself.
I mean, I don't want to die. So I think that if this clinical trial,
Right.
if it works, it would be great. But I don't want if it just makes me
Right.
sicker like what the chemo did. I don't want to do that.
And the beauty about hospice is, once you're in the program, if you want, if you feel better, if you want to try, your body's more, in a shape where they can, tolerate more chemo, you can always come off of hospice.
I don't want to do more chemo.
It's an option available, so don't think that, if you do sign up with hospice, that you're, in a bond, that, this is it, you know what I mean? So, things can happen, if you're just here to make you feel, better with your symptoms. So
How does that, I mean, what do you do?
like, we're here to manage your symptoms at home, so you're not, going back and forth to the hospital, and, since you're not getting the chemo treatment, so you might have some symptoms such as like pain, as you described, the nausea, vomiting. So our goal is to manage those symptoms at home, so you have a better quality of life. So,
how do you manage the symptoms?
So, we have a team of members that kind of, comes in and out of your house. We have registered nurses, we have certified nursing assistants, so it's a whole.
Well, how many people are going to be in my house?
It kind of depends, how you are. So, you'll have medical people, you'll have social workers, you'll have,
They're all going to be in my house?
If you want. We're not here to kind of, have too much overload. We're here to just help you. And, if you don't need the chaplains, you don't have to. If you don't need the social worker, you don't have to. The medical persons are the certified nursing assistants and the registered nurses. Then it's all being overseen by a medical doctor.
Certified nursing assistants.
Mm-hmm.
I How many nurses are gonna be taking care of me?
So the nurse will be only one, that's called your RN case manager, that's gonna, be following your case, and then the CNAs are just there available if, you get more weaker, they can assist you with showers or, activities of daily living, those kind of stuff, and that's only if you need it. Are you still able to do everything on your own, or?
I mean, I can shower, yes, but.
That's
I mean,
only if
I
you
don't know how
need
long
it.
I'm gonna be able to, with not eating, throwing up all the
Right.
time, I'm getting real weak. I mean, I don't really want somebody to have to bathe me, but
Right, and we totally understand, we totally respect that, so that's only if available if needed, if not, then that's totally up to you. So you'll have the nurse will come in, assess you, and then, they, present the case to the medical directors, and then they prescribe the medications, and then we have a pharmacy that will deliver the meds to your home, so you don't have to go anywhere to pick it up. So we specialize in pain management, we specialize in respiratory management, respiratory distress, nausea, vomiting, constipation, diarrhea, so whatever symptoms you have related to your disease process or progression, our goal is to manage your symptoms at home and keep you more comfortable, so you spend the quality time with your family. You have 2 kids that, kind of needs you at this time, and then you're with your wife, so you're not going back and forth to the hospitals.
so you really basically just have access to like good medication to control my symptoms, is that what I'm hearing?
Right. We specialize in these situations. We specialize with terminally ill patients who are, going through cancers, congestive heart failure, COPDs, advanced stage dementias. So
So
our
you have
team
like better,
specializes.
you're better at this than like a normal hospital would be?
We're not better, we're a specialty, just like how you have a kidney doctor, you have, gastroenterologist, you have, diabetic doctor. So we specializes in terminally ill patients for symptom management and providing the best care. I wouldn't say like, the end of life, because we don't know, but we provide the best care to manage your symptoms at home. So it's like an added specialty medicine that you're looking at that specializes in cancers and advanced stage cancers.
Okay.
Does that sound?
But you're
okay?
just like, so you're just managing my symptoms though, so if something goes wrong, or are you like a doctor gonna be called in, or the
Yeah,
nurse takes care of
definitely.
that?
Yeah, definitely. We also have after hours, so if something goes wrong, even in the middle of the night, like at 2 a.m., you're having excruciating pain. You have tried taking a pain medicine, it's still not working, so you can call our number, 24/7, and then they will be able to triage based upon your needs. And if needed, they would send out a nurse if the situation is not getting under control to assess your needs as well. And I forget to mention, we have inpatient hospice units. You can say it's like a hospice hospital. So we manage patients' symptoms when they're too acute to manage at homes. And they're located in 5 different places as well.
So if I get too bad off, you'll bring me to one of these places?
It's for short-term symptom management. So if your symptoms are too bad, like for example, I'll give you a scenario. If you have a lot of nausea, vomiting,